l'origine du mouvement et la raison derrière, c'est pour faire avancer le système de santé, c'est pour donner plus de chances aux soignants de bien travailler, c'est pour donner plus de chances aux patients d'être bien soignés humainement.
Quand on entend des collègues qui nous disent qu'elles se sont pris des chaises dessus, qu'elles se sont pris des baffes, qu'elles se sont fait étrangler, c'est des situations qui arrivent tous les jours en France.
Moi, on me dit embaucher, mais il n'y a personne à embaucher aujourd'hui sur le marché du travail.
Welcome to France in Focus. This week, we're taking a look at France's healthcare system. Now, it's among one of the best in the world, but it's facing an unprecedented crisis. For the past 3 months, in emergency rooms around the country, doctors and nurses have been on strike. Now, we're outside Paris's La Rue-Boisier Hospital in the 10th district, where recently doctors and nurses took sick leave as an act of protest. They say they're fed up with deteriorating working conditions that are putting patients' lives in danger. Karina Chabour and Erin Ogunki have this report.
It's a day of mourning for casualty department nurses. A sober procession to spare a thought for their colleagues at their wits' ends and for patients who have died for want of adequate care.
Bobby, you came to the ER feeling pain in your abdomen. 28 hours later, you were dead in your stretcher. Ginette, you were a nurse in the ER. You saw conditions deteriorate for a decade. You took time off because of your burnout. We thought you would come back all rested. You committed suicide.
Accident and emergency workers are calling for help, condemning a healthcare system in crisis which mistreats both doctor and patient. This casualty department, like most in Paris, has been on strike for 3 months, though staff are still required to come in to work. Open to everyone 24/7, the service is seeing an increasing number of patients, up to 400 a day.
It's always the same story in the ER. There's a lot of waiting, few hospital personnel. Unfortunately, that's the way it is, but we have no other place to go, so we sit and wait.
It's a fragile situation, the causes of which have been criticised by an independent report. It says the understaffing is due to budget constraints, resulting in intense fatigue for 80% of nursing staff.
We treat patients later than we used to. Some patients get worse because we can't treat them on time. And we are exhausted. We would like to do a better job, but parents assault us because they're worried. Meanwhile, management always demands more services from us, although staff has been cut down.
Since 2005, public hospitals have reportedly been forced to save more than €8.5 billion. But at the same time, the number of patients has doubled. Under pressure, Juliette is hoping to change jobs and start a new life. Near Paris, Barbara Couet is already planning for hers. She's a night nurse at one of the biggest A&Es in the capital. Barbara has been off since the 10th of May, her body spent after having to lift stretchers alone.
À 37 ans, j'ai 2 hernies
I'm 37,
discales cervicales.
and I have 2 disc ruptures in my neck.
Du bras droit.
They compress the nerves in my right arm.
De mon activité actuelle.
I have to give up my current profession.
Travail qui est en cours. Parce que j'aime ce que je fais.
So that's what I'm working on now, because I love my job. But it's not viable to continue in the long term, psychologically or physically.
In this suburb, there's been no strike, but dealing with labour shortages is a daily struggle.
We can't treat 200 patients with medical material designed for emergency services. 30% of patients don't need emergency services, but a family doctor. So we treat them, and we also give out beds to other services because they're shutting down. People tell me you have to hire, but there is no one to hire for these jobs that require high levels of qualification but offer public service salaries.
The doctor says the entire medical system needs reform to avoid burdening her service with treatment that should happen elsewhere and patch up the hemorrhaging workforce.
Now, to appease angry medical workers, French Health Minister Agnès Buzyn has announced several measures to tackle the crisis. She's also set up a commission to come up with ways to overhaul France's emergency services. Now, some doctors say it's not enough to undo decades of government cuts, which have led to the crisis today.
France has a problem with deserts. Not in a geographical sense, but rather a medical one. Enlarging the offer of doctors in rural areas is therefore the main objective of the government's healthcare reform plan. For Health Minister Agnès Buzyn, the necessary reforms start as early as med school. The cap on the number of students admitted to the second year will be scrapped. The objective, creating a larger pool of doctors with fewer constraints.
Let me remind you that only 5% of young doctors choose to go into private practice when they finish their studies. So if we tell the few doctors willing to settle down into private practice that they can't open their offices wherever they want, then instead they'll simply choose to work as salaried physicians.
The government's reform plan also includes several measures aimed at providing better access to healthcare across the country. Among them, creating local hospitals which provide primary care and complement larger medical establishments, as well as making it easier for foreign doctors to work in France. Experts say such initiatives will unclog overcrowded hospitals and emergency rooms.
The strong point of Buzyn's reform is to say, in order to fix the crisis in hospitals, we need more than just reorganize their structure and make them more efficient. The necessary changes come before we even get to that point. That's clear in what we see today. People don't have access to physicians, so they turn to emergency rooms.
But critics say the reform plan fails to adequately address a major problem: the activity-based financing system, under which hospitals are funded based on the number of patients they treat.
So the minister says we need to end the activity-based financing system, the idea that hospitals function like a business. But financing isn't on the table. For now, the government hasn't proposed an alternative to activity-based financing.
To put it simply, for critics, the reform law does not get rid of the healthcare system's current budget cuts, a problem many say will require entirely separate reforms.
So to tell us more, I'm joined by Dr. Patrick Pelloux, who's head of the Association of Emergency Doctors here in France. Thank you for joining us.
Hello.
Now, what do you make of the government's new measures?
The
government is aware that there's dissent within the emergency services, but I'm not sure it's really taken it on board. As you know, France has faced widespread anti-government protests, the so-called Yellow Vest movement. And because of the fluid, shambolic nature of that movement, the government wasn't able to negotiate. But in the case of hospitals and emergency services, we're talking about a very organized movement that's spearheaded by the unions. And yet, so far, the government's refused to engage in talks, and that's a real problem.
Now, it's not the first time that there's been such a crisis in the French healthcare system, but what's different this time around?
The patients have changed, society has changed. The main issue is that currently, access to round-the-clock care is under threat because general practitioners no longer offer their services outside office hours. In fact, in some areas, 24-hour care has disappeared altogether. And so the only link between those practitioners and hospitals is the emergency room. As a result, the number of patients coming in just keeps growing, from 10 million to 21 million to over 24 million since last year. And the other issue is that patients have changed. An aging population means that, unlike in the 80s, patients no longer come in with just one complaint, but with a range of ailments, and it's become very difficult to handle. So the emergency services have become a buffer zone that's left to handle all the effects of a dysfunctional health system, not only on the medical and psychological front, but also the social consequences. It all ends up in the emergency room.
Now, in France, there's talk about a vocational crisis, about fewer people actually wanting to become doctors. Why do you think that is?
Today's young medical students don't want the constraints of a job where they'll have to work at night, on weekends or on bank holidays. They want comfortable jobs where they can work a classic 9-to-5 and only on weekdays. But emergency medicine, resuscitation and surgery, all those jobs come with long hours, with overnight work every day of the week.
Et on s'aperçoit que le monde médical
And those time constraints are putting a dampener on vacations. So the world of medicine is now rejecting these constraints, and it's a social issue for doctors and medical staff. But the effects are being felt by patients.
It seems like there's no signs of this crisis abating anytime soon, and we're approaching the summer vacation period, which is typically a very busy time for the emergency room. Are you worried about the level of care that some of the patients will get during this period?
Très inquiet.
Extremely worried, because the weather forecast indicates we're set to face another heat wave this summer. We see that these heat waves are recurring more and more frequently, and they are deadly. The last heat wave here in France was last year, and an estimated 7,000 people died as a direct result. So this modern, rich nation that is France is facing the consequences of climate change. And while it is in crisis, our health system is one of the best in the world, but it's going to have to take on a massive challenge in the years to come. And we're likely to see the crisis deepen in the coming months as a result.
Patrick Bellou, thank you very much for joining us here on France in Focus.
Thank you very much.
And thank you very much for joining us. Stay tuned for more news here on France 24.